Okay, folks, welcome to Friday's report out. It's great to see you all. First report out of 2021, and appropriate that we've got the vaccination programme team reporting out, given all of the ambition and challenge we know about in relation to vaccination, and also really good to have the patient experience team here as well. So let's kick off. Let's make a start with our first report out, which is from the vaccination programme team. So guys, over to you. Take it away.
Good afternoon, everybody. Hello, my name is Matthew Spence. I'm the team leader for the vaccination centre. I'm a pharmacy technician. I'm also a Kaizen promotion specialist within the Kaizen promotion team. And welcome to Report Out today. So we're here to talk about the vaccination programme, which has now been up and running for 4 weeks. We're in our 4th week of vaccination from pretty much what was a standing start at the start of December. So we've learnt lots. We've built a centre, and yesterday we vaccinated 471 people, which is amazing from where we were in week 1. Next slide, please. So this is our target progress report, which we have only recently agreed, basically because it's a completely new process, and we had to firstly understand the process before we actually developed the target progress report. So one of the things that we always measure as part of the target progress report is the lead time. And in week 1, when we first started, we had a baseline of 41 minutes and 4 seconds. By week 2, this was down to 33 minutes and 22 seconds. And later on, we'll be sharing with you our new lead time through Gareth. We've set some targets around customer satisfaction, because we also want to know how our citizens are feeling about having the vaccination programme at Leeds, and also importantly staff morale. Alison will be giving you an update around the feedback that we've collected so far. We also collect our WIP and our SWIP, but we've also agreed a quality defect around the people that did not attend, so the number of DNAs, and we're working on some data, and we have a target of 0 for that. Next slide, please. So for those of you that are familiar with our current process, we normally have we actually have approximately 4 steps in the vaccination process. That you have a booking in, so you have a reception process where in the previous weeks we've had a 2-stage reception process. Then we have a consenting step where a person will fill out their consenting form and then be consented with a medic or a consultant pharmacist. Then they're moved on to the actual vaccination pod where the person is vaccinated, and then they are moved into recovery. And we in the vaccination centre at the Thackeray Museum are using the Pfizer vaccine, which means that there is a 15-minute minimum recovery stage. What I didn't mention on the previous slide was our target for our overall lead time. So we can see there that it's 32 minutes and 22 seconds on our just before Christmas when we measured the lead time. But our target we've set ourselves is very ambitious and very aspirational, 20 minutes. And that includes the 15-minute recovery period. So we would like our patients to be in and out in a very safe, but also a highly efficient manner, so we can vaccinate as many people as possible, because as Julian's alluded to, we are under extreme pressure to get as many people vaccinated as possible, and we're looking at vaccinating approximately over 3,000 people a week. Now, I'm going to hand over to Kat, who will talk to us about the PDSA cycles that we've started to implement to see some improvements. Just bear with me. We're socially distanced. I'm going to just move across.
Hiya, my name's Catherine Johnson. I am a mental health nurse that's been redeployed to the vaccine clinic. So I have been, next slide please. So was the reception, and to reduce the time that when people walk through the door, get booked in and then marshalled upstairs. So we initially used a clock system outside to allow the citizens to know what time appointments we were looking at. However, we found quite early on that that wasn't working effectively, as the citizens were sort of getting muddled up in the queue. So we removed that, and we're not using that at the moment. We've then implemented 2 reception desks at this point to increase the flow, whereas initially we were having a reception desk and a COVID screening. We have now got the COVID screening questions on the outside of the door and on the Perspex screens, as you can see on the picture, for the citizen to read prior, and they answer that when they arrive. And now all the documentation, sort of leaflets, are now available before they arrive, so they don't have to read everything when they come to the centre for their vaccine. So I think I'm handing over to Sophie now, and the next slide, please.
Thank you, Kat. The team in the vaccination centre also realised quite quickly that the recovery in itself, due to the guidelines of having to wait 15 minutes post-vaccination, there was sometimes a bit of a queue, not enough seats. And so with some clever thinking and determination from the team, they managed to keep chairs still socially distanced, but increased the chairs from 13 to 20, so they're still far enough apart, but there's they maximise the space in the recovery area so more people could sit and recover. They also introduced a recovery timing card, a bit like a Kanban or a visual control, which is handed to the patient by the vaccination nurse, because we realised that from point of vaccination to sitting in recovery, there were a couple of minutes that we could shave off this recovery time because of walking to recovery, etc. So to make the most of that, the patient's now given a card that's shown on the screen there that notes the time, exactly the time their vaccination is given, and the 15 minutes after, giving the patient the empowerment, I suppose, and accountability to say that's the time you can leave. And that's been working really well. The KPO team realised that had been in and out of the vaccination centre that huddles were a really big part of the vaccination team's day-to-day work, and actually the improvement side of it and the PDSAs we needed to sort of formalise that a bit. So we've got some structured meetings now that happen on a Tuesday and a Thursday that involve the improvement team and the community team and any LTHT staff that are involved in the vaccinations, so we can share information and update each other at those meetings. This involves a production board and a huddle with the key people involved in the PDSAs. And so far this week, it's been working really well, and it's quite a positive environment. The team have also started to look at inventory, what's necessary, what's not necessary, and started using the tool we use in the Leeds Improvement Method called 5S to see what's really needed in the vaccination pods and in the storeroom. And that work has begun in terms of labelling and seeing what might need to come next. Thank you very much. Next slide, please.
Hello, my name's Alison Beckett. I'm the Head of Nursing for Medicines at LTHT. So as Matt's alluded to at the beginning, we're now week 4, so we felt that it was really essential that we got some feedback, both from our customers that are coming through for the vaccine, and that this first slide shows the results of the emotional touch point surveys that we've used, which is in line with the Leeds Improvement Method. So we are lucky that we've got that window of opportunity to get the opinion of our customers, because they are waiting for 15 minutes. So we've had really good uptake of the emotional touch points, with 54 people within one day talking about their experience. And as you will see from that, 90% of people felt that they'd had a positive experience within the centre, which is fantastic. We obviously have taken on board some of the negative feedback that we've got, and a lot of that is around parking. So that's going back to our operational group to see how we can improve that. The other key question that we wanted to ask our customers was around the booking experience. I think it's fair to say that our entire team would say that the booking system and ensuring the right people are at the centre at the right time has been one of our biggest challenges throughout. So we felt it was really important to ask the customers how they felt. We were quite surprised we got such a positive feedback of 66%, because we know there has been challenges, but that just shows us that it is fit for purpose, and we have obviously still got some work to do around that, which, as I say, we are taking back to our operational group. Next slide, please. So the other people, obviously, we were asking for their feedback were the staff. Now, me, along with other nurse leaders, had this as a concern right from the beginning. We had multiple professionals coming together across multiple organisations and expecting them to work within a team together with a 20-minute huddle at the beginning. So lots of thought and planning had gone into how we could manage that and how the huddles were going to be effective and productive. We haven't had as much uptake as we would like, and we're going to continue with doing the emotional touch points with the staff. But from the 8 respondents that did give us the feedback, they felt it was a really positive experience. They'd enjoyed working in the centre, and that they felt they knew what they were doing, and that they felt they worked effective as a team, which is fantastic feedback. We will continue with this to get some more, emotional touch point surveys from people. But anecdotally speaking to the team, everybody's really enjoyed it and getting so much from working with other professionals and with other organisations, and really feeding on ideas and how we can improve the service. I've been absolutely astounded at how well all of the staff have worked together, and that's brilliant to see that they have enjoyed their experience as well. I'll hand over to the next person.
Good afternoon, everybody. Hello, my name's Gareth Dolby. I'm the General Manager for the Leeds vaccination programme. So the latest patient lead time that we've managed to achieve this week is 27 minutes and 53 seconds. Matt alluded to earlier that our aspiration is to get this down to 20 minutes, and that's come down from a time of obviously 41 minutes and 1 second, as Matt alluded to at the start. So over the last week, we've decreased this lead time by 32%. So it's an absolutely huge effort put in by the team. And I can only echo Alison's words there. We're now only on week 4. So I think that's really, we've got to put this into perspective, that the unit's only been running for 3 weeks. Next slide, please. Moving into next week, we want to continue with the PDSA cycles, which Catherine alluded to earlier. We want to focus on that one cycle of work at a time. And we also want to focus on the well-being and the morale of the staff. And how we're going to do that is we're going to continue to develop our huddles and our handover to make sure that we set up all of our colleagues for success for the day. Every single day we are making incremental gains on the amount of citizens or staff that are coming through the centre to be vaccinated. So it's definitely working what we're doing now. We just need to build up on it a little bit more. and then we're going to continue to target set. This will ultimately work into a business as usual standard work, and we will only set our colleagues up for success moving forward. Next slide, please. So some of the lessons learnt and challenges and barriers so far, we've found that since we've had a change in government guidelines on how long it is between vaccinations, that we're getting a fair few DNAs, but we're able to counteract this by filling those slots with staff, and this avoids wastage. The booking system is still very much in its development stage, although it's live. This week we've had a couple of challenges with the booking system, but the company who own that system are working very closely with us to make sure that we don't lose any of that activity, and we're working quite closely to bring it online. And then we're prepared for anything really. We have moving goalposts, as I've alluded to there, with the government guidelines, and we're there ready to react to this. I think it's my first week in post, coming to the end of 5 days, which already feels like 5 months, but it's been an absolutely very enjoyable and challenging week. The centre opened, like I said, 4 weeks ago on the 8th of December, and the improvement that has been pulled together through this Kaizen event is testament to the dedication of the teams, and I can only echo what Alison has said. I'd just like to also say that this is a great footing at Thackeray, and the gains that we've made at Thackeray for opening the larger centre on current planning the 18th of January, where we'll deliver 23,000 appointments from the start. The meeting this week, which was chaired by Tim Hiles, the director of the programme, we've got together to decide how we were going to start the larger site and how many appointments a week were going to be put onto the templates to begin with, and it could have been a lot less than this if we hadn't got to the position that we're in today. So well done to the whole team over at Thackeray and all those supported. Thank you.
Great. Thank you so much, Martin, Catherine, Sophie, Alison, Gareth. Really good. There's loads I want to sort of ask you, and I'm sure others do as well. It's really exciting. What great work. Really excited by the way that you've gone about the improvements in such a short space of time. But we're going to hold questions to the end because we want to do justice to all report outs, and I'm delighted actually that we've got a patient experience team, and I think, John, are you going to lead us off on the complaints 120-day report out?
I'm going to lead you off, Julian.
Oh, Christina. Hi, Christina. I didn't see you there.
Yeah. So I'll crack on, everybody. So hello, my name is Christina Kozłowska. I'm the head of patient experience and the lead for complaints in the organisation. I said this last time, but I'm absolutely delighted to be here to deliver the next report out for this programme of work. We're now at 120 days with the CSUs that are currently taking part in this, who are TRS, ESM, AMS and Children's. And just to explain, we've continued to decide to report out this work beyond 90 days, as lots of teams do, because of the cycle time related to complaint responses. So we tend to work to 20, 40 and 60-day targets. As a result of that, it takes some time to get to the point of being able to evidence sustained improvement, which is why you'll see me and the existing team working on this around for a little bit longer. So as a reminder, before we move forward, focus of this programme is to improve the timeliness of complaint responses, so improve the experience of our complainants, which is really important, isn't it? And the quality of the responses that we provide. So next slide, please. And the next slide after that, please. I've spoken to that one. Thank you. So the first thing I just want to talk you through briefly is the TPR chart. So what is our data looking like 120 days in? And it's looking good. So just taking you through the CSUs one by one. We've got AMS, who've seen a little bit of an increase in their lead time this report out, from 792 hours last time to 1,800 and some this time. However, in terms of the shift from their baseline at the beginning of this programme, we've got a 31% improvement. So, you know, great news going on there. Children's services continue to see an improvement in progress. A 120-day position is a lead time of 792 hours. Brilliant. And a 46% change. And what that means for this team, which is extraordinary, is that at this point now they have almost achieved the target that was set at the beginning of the programme to see a reduction in their lead time of 50%. So absolutely delighted for the children's team on that one. TRS have also seen an improvement from their baseline position and are currently running at 39%, a positive shift, and EMS are at a 21% positive shift, running at a lead time of 984 hours now from 1,200 at the beginning of the programme. But for the ESM CSU, they were in a far better position at the start of this programme than other CSUs. So their baseline was better than the trust average. So overall, a really positive position that we're reporting today. In terms of the work in progress of this team, and here we've been looking at the complaints that were open at the time the programme opened, and the number of those complaints that the CSUs have managed to close down. And in all cases, in every single case, we've seen an improvement. Children's last time reported that they'd closed all of theirs down, and that of course continues to be the same. TRS are only one complaint away from reaching a zero position now. So again, great stuff being reported there, and improvement in all areas. And the final bit I just want to bring your attention to is the defect data, which you'll see at the bottom of this slide. So this importantly looks at the quality of our complaint responses, and here we're just trying to identify where complaints have been reopened for reasons that the CSUs have influence over. So this might be for reasons such as a complainant saying that the information in a response wasn't accurate. And it's brilliant to be able to report that for these CSUs, not one complaint that was opened since this programme began has closed and reopened, has done so for a reason that they could influence. So brilliant. That shows us that quality of complaints are improving. Next slide, please. Very brief on this one, everybody. We set out some actions at the beginning of the programme that we had intentions to complete. They're all done, bar one, which completes this afternoon and relates to delivering coaching sessions for the CSUs. We've got our final one this afternoon with the AMS CSU, and after that will be completed. Next slide, please. And finally from me, just to say that there have been no changes to the complaint team actions since the last report out, insofar as we've completed everything that we set out at the beginning of the programme to do, and we have maintained and sustained those actions where we've needed to. So there's been no negative shift in that work. Next slide, please. I'm now going to hand you over to the CSUs themselves. I will just say ahead of time, we've unfortunately had a couple of our CSUs possibly unable to report today because of other commitments. And depending how quickly we get through this, it might be one or two of those CSUs. John will manfully pick up those slides, however, in their absence, so you'll still get the information. Thank you. So over to AMS.
Hello, my name is Julie Lofthouse. I'm the lead nurse for quality and safety for AMS. So where are we? So we've still got a band 6 and non-clinical staff that are helping us with the complaints process, and we're seeing great improvement there. We're starting to look at the number of responses that we get back from external QA, and we've been looking at our data, and we can see that since October, we had 31 complaints closed and 12 of those were returned, but they were for minor comments rather than huge rework of the complaint responses. So that's really good, and that's really heartening. We've got our standard work in place. We've got an escalation process in place. We've got staff going for the coaching classes. And we are still using nurse specialist teams and PET team just to help with those tricky issues and where patients need support if they can't have the surgery soon enough. So we think the impact is definitely a better engagement and ownership with the complaint process. We have got improvement in our responses that we are producing. I think staff have got a better understanding of the issues. And we are looking to start asking staff to contact complainants when the complaint comes in, just to really understand and make it more personalised what the issues are that they're having with us. So where are we 120 days on? So we've actually closed 16 complaints in December, which I think is a real achievement, and that's despite everything that's going on with COVID and Christmas. We've had a change in our senior management team, and we're challenging ourselves to keep up with that now. We do have a 48-hour turnaround for our internal QA by the head of nursing, and I think that's a real major achievement. And yeah, we're doing very well. So next slide, please.
Hello, I'm Celia Mackenzie. Christina and John will be pleased to hear my voice because I was one of those that might have had to leave. So this is the children's update. So what have we done? We continue to have excellent engagement with the complaints team, and we found that that has been really valuable, and we will continue to do that. We continue with the joint responsibility for management of QA by the GM and the head of nursing, and we aim to turn those QAs around within 48 hours. The weekly huddle and the use of the complaint board is really useful, and we're tracking contact with the complainant as well, the call to the complainant. And we've just in the last few days actually started to see that a couple of complaints, one definitely been withdrawn and one that they're thinking about withdrawing. And this is going to be something that will be useful to look at going forward, and it's whether we're having that conversation has made people think differently. Of course, we need to make sure that we've answered their questions and their concerns, but that's something just new from the last few days. Each of the specialties have a tri-meeting, and complaints is on the agenda, and we continue to support the QA process by making helpful comments when we're sending our complaint back for QA. And we have a flow chart in place now to monitor the complaint process from when we receive it to when it goes out for QA. Some of the work that we're now beginning to do is looking at the actual QA, internal QA process, and how long that's taking. We've been involved in the coaching sessions, which members of the teams that respond to complaints found extremely valuable, and we'll continue to work with them to improve their initial complaint response, therefore shortening our QA time. The impact of all this is that we have an improved response to families, and as you've already heard, we haven't had any complaints reopened that we could have done anything about. It's usually a different question that's come up once they've received the complaint response. Obviously improved patient engagement and patient experience, and I think one of the really big messages from this is our relationship now with the complaints team. It felt very distant before, but I and all of us now feel able to ring them up, and it's definitely a two-way process. And being able to respond to the complaints in a timely way and not see all those really long waiting complaints on the complaint board has definitely improved staff morale. So where are we now, 120 days on? We have currently no complaints exceeding the agreed response time. In fact, they're going back for QA at least 14 days ahead of the agreed time, and I don't expect that to change. Even some of the really complex complaints, we're dealing with those proactively and in a different sort of way. And obviously that's reducing the response time from receipt to response sent. Next slide, please.
Thanks, Celia. This is John White, the lead nurse in the patient experience team, and I'm speaking on behalf of the ESM CSU. They send their apologies. I really want to focus really on the medical involvements that ESM have been engaged with And this is one of the key themes running through the complaints programme, the KPO programme, and trying to get, I guess, parity across the board in terms of how complaints are responded to. So in ESM, the CDs are now being asked to identify cover for medical colleagues when dealing with complaints. There is good engagement with the clinical lead, with all 80 consultants to be involved with the complaints activity and also with the masterclass that has been delivered. And overall, they say there is good engagement from the medics, and this is something that we like to see across all the CSUs as we continue with this particular programme. They've also introduced escalation processes for staff absence. And again, across the 4 CSUs that we've worked with, the standard work description is helping to, in terms of their accountability at their weekly meetings, to help process deadlines. They've also been doing some internal QA coaching with the author of the response, and this is one of the focus of the coaching programs, which is innovative and a really good thing to do. And as Celia mentioned about staff morale, it can really help to boost individuals' morales when they know what they should be, how they should be responding. And the weekly complaints meetings have been set up, and these are proving really beneficial as well. So the impact of all these changes, there's more timely internal QA of the complaint responses, a reduction in the number of complaints that are open, and the standard work is changing the conversation with the team and driving change, i.e. this is how it should be done, and this is what everybody else is, this is what we are doing. So they've got a sustained reduction in time taken to internally QA complaints with an average of 17 minutes. And also we can see from the data that things are improving as well in terms of the lead time, as Christina explained earlier on. I'd like you to pass over to Diane now from TRS. Next slide, please.
Hi everyone, my name's Diane Armstrong. I'm matron in TRS, providing an update. I've not been part of this piece of work directly. Our Hon Donna Pearson has, but I've been working very closely with her on it. So our update on where we are now. We have implemented our weekly huddles, and they're taking place every week, and we review current complaints, we track where we are with the stages within our complaints, and offer support to anyone who needs it with resolution of complaints. The complaint handler from the patient experience team is coming to those weekly meetings with us, and we're providing coaching in real time to improve the quality of our responses. That's been through the coaching sessions with the patient experience team, but also our Hon Donna is working with 3 of our business managers around their experience of complaint responses. We are now trying to ring our complainants when we receive the complaint through, just to give that assurance that we're dealing with the complaint, we're taking it seriously, and to ensure that what's there and you know the response they're needing from us. Our open complaints have reduced since we took on these improvements. Our current position is 13 complaints, of which 5 are in our QA process, 5 are still within correct time frames. We do have 3 overdue at the moment. 2 are historical, and we've only had 1, which I think Christina mentioned at the beginning, which is outstanding, and we're hoping to complete. We've had no defects measured in reopened complaints, and we're working really closely with the whole team to ensure we continue to make further improvements around our complaint handling and responses. Our focus going forward is to continue with the complaint huddles. Everyone is finding them a useful piece of work. To continue with our coaching throughout the team as we bring on more of our senior staff with complaint handling, and to improve our timeliness. We aim to achieve 100% by the end of March this year. Thank you.
Thanks, Diane. Next slide, please. And just to finalise, our next steps are so we want to continue with the weekly accountability meetings with the 4 CSUs involved in the project. This has been really effective and helpful for all of us, and as Celia mentioned about developing our relationships. We'd like to continue to report out every 30 days. This data is early, and we need to see the data mature as time goes on. And I think it's going to take probably 2, 3, 4, 5 months before we really see some the real differences in the performance. We want to share learning with all the CSUs, all CSUs. So those of you on the call today, we will be coming to talk to you about the complaint handler attending the weekly CSU huddles and helping you to set the these up, to introduce standard work plans, which are actually on the intranet now. So if you are not involved with the project, please take a look and have a look at the work plans, and also adding in ringing the complainants at the outset of the complaint. I hadn't been aware of Celia's of 2 complaints being withdrawn, and that is a fascinating insight into how ringing complaints at the beginning of the complaint can really help, and I think that's a major step forward as well. We'll continue with data monitoring within the CSUs. Also, we are undertaking a major data reporting review. The KPO programme has changed, certainly in my mind, how we should be reporting out with complaints, and so has really helped to focus my mind, and that is something we will be able to share in due course. And we will be including 4 new CSUs in February, and we have in our minds the CSUs that would be beneficial to take part. Thank you very much. That is the end of our report out. Thanks for listening.
Great. Thank you so much. Really good, really good. Thank you, Christina, John, Julie, Celia, Diane. Really, really good stuff there. I'm again, loads I could ask, but I just wanted to, like the vaccination team, say how encouraging that is and how well you're doing to take this work forward. Really important piece of work. I did actually can see on the participants list both Phil and Lisa on the call. Wondered if Phil might want to comment on the vaccine programme, and then Lisa on the complaints, and then we'll open it up to questions.
Yeah, thanks, Julian. I mean, just first off to say what a big well done to the KPO team and the vaccine team. I mean, you know, to get from a standing start where we know where we were, the presentation today is just absolutely amazing. So you should be really, really proud of that. And I think I know that we've colleagues from across the city have just been hugely impressive by how we've gone about doing this. And I think what's really exciting is not just the kind of wonderful work, which I'm sure we'll get into some questions about, Julian, but also the fact that this was kind of a new service, and when we did the methodology in real time as we were going along, which is probably a first for us because it's generally been looking at things we've already been doing. And I just love the buzz from the team about the real power of the method to make those changes in real time with the kind of the huddles and the quick conversations and the PDSA. You know, the real sense of empowerment that came across for me about how you've just kind of gone about making it better for people coming for vaccination is really fantastic. Thanks, Julian.
That's great. Thanks, Phil. And just to say, talking of real time, hope you don't mind, guys, but I was taking some screenshots of the slides and sent them across to Hugh McCaughey, who's the NHS National Director of Improvement, and he sends a message saying, congratulations, a great achievement and a perfect example of how improvement can help at this time. So I think really good to have that recognition as well and see how we use the method to address some of our most mission critical challenges right now. Equally impressive, I think, the work on complaints in terms of what we're doing, which is hugely important in terms of our patient-centred approach. Lisa, do you want to give some reflections on that?
Thanks, Julian. Just to say, I mean, fantastic work with the vaccination programme. That's, you know, just a big congratulations. But the work on complaints is, I'm just absolutely blown away how you've continued to go with this and work through it, given the operational pressures and challenges. And we know it's absolutely for the right reason. But certainly, I mean, Celia, that's so interesting now, knowing that people are, you know, have decided to withdraw a complaint. I mean, we could be entering into a completely different way of managing our patient feedback, you know, by this. And I'm really excited to see where it takes us. I know the board are really interested on this piece of work, And as always, I'm just excited to get it mobilised across the organisation. You've done amazing, all of the CSUs, and certainly the patient experience team. You know, you've worked incredibly hard to change the policy, to embed that new policy. And so, yeah, really excited to see where it takes us now. And we are feeding back to the board at the next meeting, Julian. So I'm sure they'll be really pleased with the progress so far.
Yeah, absolutely. Great work. So questions, I know we've run over a bit, but it's been worth it, hasn't it? I think, Tim.
Hi, Julian, thanks for that. I've got a bit of a comment on reflection rather than a question. I had been going, I do think it's important to echo what Phil and Liz have said about embedding the KPO into the development of a brand new service. The benefits of that have far outstripped anything I expected. Yeah. And absolute credit to the team for how they've done that. The reflection was something about being in the unit today and how we talk about vacant capacity. A number of people have engaged with me this week to say we could be doing more, we could be doing more. And you know, downtime is clearly a sort of waste, but I've been reflecting back to them that actually we've increased the number of patients that we've booked this week, and that downtime is an indication of the success the team have had in the changes that they've implemented, and we will be introducing more. So it's that thing of actually not seeing it as failure but seeing it as a success of the programme, and I've sort of encouraged the team to reflect that back to the staff who are working. And I would say, I would echo the points that Lisa made. I started my career as a complaints officer many years ago, and I know how difficult it is to engage people in doing complaints differently. So absolute respect to the guys for how they've done that.
That's great, Tim. Thank you. Well said. Just looking across, see any more hands for questions or comments. Anthony.
Hello, Julian. Hello, everybody. As outside eyes watching in on that, I just want to congratulate all of you for the fantastic work you're doing on both of those things. The complaints thing, I was actually involved in the RPIW on that. It's great to see the product coming through of actually checking that we've captured what the complaint is actually about, because that was central to the discussions that we had, making sure, and it's clearly paying off. So that's great. On the vaccination one, I think that's fantastic work going on. It doesn't surprise me that using Kaizen tools, it has enabled you to make the structures that you needed so efficient. It doesn't surprise me at all. But I'm staggered that you've managed to reduce reception, consent and vaccination, or are aiming to 5 minutes. And I'm just intrigued to know how you've overcome the problem of discernment, which goes alongside consent, because that can take time. I'm just intrigued, or perhaps it hasn't presented itself yet.
Thanks, Tony. It's good to see you. I hope you're keeping well.
Yes,
very good. So any of the team want to respond to Tony's question about how you manage within that timeline?
I'm happy to come back on, Julian. I think the consent thing has been really interesting, to be honest. And I think one of our game changers to actually decrease the time of consenting is that information going out beforehand to people. The company, along with all of the information that we've been given around the vaccine, is given to every patient. And at the beginning of person, customer, whatever we're calling them, at the beginning of the programme, we were having to give that because it had only just come out at the door. And then we were having to give people that time to look through what is quite an extensive documents to make sure that they'd read everything and that they were happy to go ahead. Because there has been lots of questions around it. I think we've seen a real split between people can't wait to get to the door, and other people who are a little bit reticent, understandably. So I think the big game changer has been that information now is part of the booking system. People have it at home once they've booked their appointment to read through at their leisure, and then people are presenting really with questions rather than having to work through the document. So I think that's what's helped us reduce that lead time at the consenting station. And I think aspirationally and nationally and for us is that we would go electronically, which would reduce it vastly, those lead times. But I think it might just that might take a little bit more time.
Great, thanks very much, Alison. Any other questions? Can't see any, and I'm sure there'll be we can use the comments box, which we can retain for and follow up with anything we need to pick up. I'm just checking that. There's some nice comments in there. Nice to see Adrian's comments. And Jimmy's on the complaints. Yeah, some nice comments in there. Worth a look. Great. Well, thank you very much, everyone. That's been a genuinely inspiring report out at the start of 2021. Let's hope it's a harbinger of more good things to come as we contend with the major challenges that face us. But with this level of teamwork, collaboration, working in the Leeds way with the Leeds improvement method, I think we've got every reason to be optimistic about how we go at those challenges. So thanks, everyone. Please join us at the next report out on Friday the 15th, same time, same place, wherever your place is. It's a virtual place, but who knows, maybe later in 2021 we'll be able to gather together as we've done in the past for report out. But in the meantime, thank you very much, everyone. Do stay safe, look after yourselves, and well done again to both the teams that have reported out today. Great work, guys. Thank you. Take care.